Thank you, everybody, for coming to our online panel discussion. We're going to give people another 3 minutes, maybe, for folks to trail in. I know that it's early, and we're really, really happy and privileged to be with you all here. Thank you so much. Another 2 minutes, and then we'll start the discussion for today, maybe 5 minutes after. Thank you so much. All right. I think because we're recording the session, I would like to have a robust discussion, and so we'll allow for more time so that we can have time to talk and discuss the topic of the day. My name is Dr. James Mruti, and I am an assistant professor in the CFT department at Drexel University, and I'm zooming in from the beautiful country of Kenya. It's about 5 p.m., 4 after 5 here. And so if the internet is a little choppy, just send me some money to buy a better internet. Thank you all for being here. A warm welcome to you all to the Black Immigrants Working Group's online panel discussion. And the topic of the day is understanding the experience of new Black immigrants in Philadelphia. And this is an academic community advocacy effort. And the idea today is to understand Black immigrants' health and wellness in Philadelphia. We are a part of Drexel University's Urban Health Collaborative, and we are made up of researchers, students who are eager to understand and improve the health of Black immigrants through research and advocacy. Well, today we have invited an excellent panel of a researcher and a community advocate and leader, and I'll introduce them in a second, and they will be the people who will be the experts of the day. So my job today is just to navigate the discussion. And today, really, this event is part of Philadelphia Office of Immigrant Affairs celebration of Immigrant Heritage Month. I'm sorry. And in this celebration, residents explore their heritage and celebrate the shared diversity that bring us all together. It's also a chance to highlight the vital role of immigration in the United States and recognize the many contributions of immigrants to the United States. It's important also to note that we're using this platform to also highlight the amazing work that our Black Immigrant Working Group does. And today we're not going to highlight all the researchers and student assistants that work with us, but we're going to actually highlight one of us, who's Dr. Koku, in a second. So what should you expect? You should expect that I will introduce the two panelists, and then I'll have a guided Q&A. I'll ask the questions, and my panelists will answer the questions. And then we'll also invite crowd questions. So people that are in the panel, people that are in the chat today will ask questions in the chat, or they can raise their hands. I cannot see you all, but my very capable Dr. Ope Yemi will track the hands, and then maybe she can cue me in to ask those questions. But before I introduce the panelists, I would like to acknowledge all the Black Immigrant Working Group members who are in attendance and those who are not in attendance. Especially, I would like to give special thanks to Doctors Opeyemi and Dr. B. Mruti for coordinating this online discussion. Without them, we would not have this chat today. So, on to my panelists. I know I've held you for a long time, and they're amazing as you can see them. I would like to start with Director Oni Richards. Director Oni Richards is the Executive Director of the African Family Health Organization, and throughout the discussion, you'll hear us call the organization AFAHO. And through her directorship, she's led the expansion of the holistic service to Philadelphia Africans and immigrants from the Caribbean as well, and refugees in the community. And she's also created strategic partnerships through developing the first community clinic partnership in Philadelphia for women impacted by female genital mutilation, collaborated with local and national institutes and the government entities as well. She has over 10 years of experience focused on health outcomes and promoting health equity. She also does peace building and advocacy, and she's worked with organizations such as AFSC on campaigns for debt cancellation and fair economic policies for African nations. As you can see, she's very accomplished. And so I'm just getting highlights from her long resume. She's in the inaugural board of health members, instrumental in developing Delaware Community First Health Department. Also, she attended Harvard Business School SPNM program, where she got a scholarship to advance management skills and also administrative skills. She has published as well in the Journal of Social Innovations journal, that's the Journal of Social Innovations, sorry, and numerous awards. I'll just mention a few. Philadelphia City Citations for Leadership, Human Rights and Dignity Innovator Award, that's 2018. 2017, Women of Influence Award. 2017, Community Leader Award. 2016, Echoes of Africa Community Service Award. As you can see, these are very accomplished executive directors will bring to you today. Nationwide and international speaker as well, as you will see in a moment. That is our director, Oni Richards. On to Dr. Emmanuel Koku. Dr. Emmanuel Koku is an associate professor in the Department of Sociology at the Drexel University of Philadelphia. He holds a PhD in sociology from the University of Toronto, Canada. His research and teaching interests include social network analysis, global health, medical sociology, developmental psychology, and quantitative methods. His research focuses on determinants of HIV risks and protective factor behaviors in Africa and its diaspora. And that's important because of this discussion today. And he looks at lived experiences of persons living with HIV, as well as the social and structural dynamics of learning and knowledge works. Findings from his work have already been widely disseminated across many outlets that publish academic journals. Aside from his scholarship pursuits, Dr. Koku is actively engaged in applied policy related works, working with federal, state, and local community initiatives aimed at addressing health disparities in African immigrant communities in the United States. Without further ado, I would like to begin the discussion today. Maybe before I do, I'll give both of them an opportunity to just say a brief hello, and then we'll jump into the questions. Director Richards, please say hello to the folks, and then we continue.
Good morning, everyone. Looking forward to engaging with you all on this important topic. Thank you.
Excellent. Thank you, Director. Dr. Koku?
Good morning, everyone, and thank you very much to Dr. Maruthi, all the organizers and members of the Black Immigrant Work Group in Drexel here. This has been a long time coming. We are very happy that we are able to put this together, and I'm looking forward to the discussion today as well.
Excellent. Director Richards, could you just briefly open up by telling us how you're associated with working with immigrants in Philadelphia? So what do you do for immigrants in Philadelphia?
Sure. So I'm the director at African Family Health Organization, and AFAHO has been around for more than 12 years now, primarily serving the health, social, and educational needs of African and Caribbean immigrants and refugees. So we have a host of health programs that are community-based, community-informed, social programs, and an education program that provides services for after-school programming, weekend programming, and adult literacy for our adult learners. And so, yes, we serve people from across the continent, primarily West Africa, some East Africans, and fewer Southern Africans, as well as the Caribbean. And our clients live across Greater Philadelphia, mostly Southwest, Northeast, and in Delaware County.
Thank you. Just a quick follow-up. What's been the most rewarding thing that you've done?
The most rewarding thing, I think, is just the community that I am also an immigrant from Liberia, West Africa. And so I came here as a refugee due to the civil war in my country. And so I've walked in the shoes of the people we work with. And so being able to have experienced what many are experiencing now and be in a position to be of service has been the most rewarding thing. And then just getting to work with the staff who are also mostly from the Caribbean and Africa, you know, the way we collaborate, the way our work is community informed. Yeah, there's so many things. And then the community itself, this community, yes, there are a lot of issues, but the community steps up in times of need. Just recently, just briefly, we had somebody who passed away, a young man who passed away in the community, and he was here by himself with, you know, just working low-wage jobs, didn't have any money for his burial or to send him home. His mother wanted him to go back, the body to go back home. And the community came together and raised $23,000. People sending $10 and $5, and until they raised $23,000 to send him so his mother could have her son's body at home. So it's just, and there's so many instances of that. And so it's fulfilling doing this work. It's fulfilling. Yeah.
Excellent. Thank you. And sorry for your loss. Dr. Koku, describe your work with the African immigrants in the Philadelphia area.
Okay. Thank you very much. My work actually started around 2005 when I arrived in Philadelphia. I wanted to understand, get to know the African immigrant population, and then get to know the type of work they do. So roughly around the same time, I was in contact with a former classmate of mine who was working in the Office of Minority Health, and I contacted them. And they informed me that they have a program actually on African immigrant health. And so I became allied with them. And through that, I got introduced to a number of African immigrant organizations. Incidentally, the first one I got introduced to was African Family Health Organization, where I started working with Oni and then the former director, Tigida, and I've been on their board of directors since then, and I've engaged with them over the years, playing various roles. I think on one side, I'm an academic partner. So as a researcher that partners with them, they were like a sub-awardee for my grant when I was doing a grant on HIV risk and HIV stigma. So they played a really very important role in that to help me recruit participants for my study and then to get to know community better. Then at the same time too, I also worked as an informal consultant for the African Family Health Organization and later the other one, ACANA, over so many initiatives, trainings, conduct trainings for them, and also being part of advisory boards on various initiatives that they engage in. And the female genital mutilation, female genital cutting, have been part of that, and as part of their COVID education efforts and so on. And more recently, as part of the No One Left Behind type of a promise grant that is supposed to increase access to social services in the Philadelphia area. So over these, 10, 15 years, I've been playing this type of hybrid roles as an academic researcher and also as a community consultant, working to help the organizations and to help the community.
Thank you. I like that. You're saying that you're going between doing research and also advocacy and being practically in the organization, and I really do appreciate that. This next question is really geared towards Director Oni. Oni, tell us a little bit, for the folks who do not know, like Dr. Koku, what's the composition of the African immigrants in the Philadelphia area? Just a brief overview.
So the most recent data published by Pew Trust indicates that about 120,000 African immigrants in the greater Philadelphia area. I think it's way more than that, but that's what the official data is saying. And even that is a lot, right? And so based on our work, the majority are from the Western Africa area, across West Africa, Liberia, Sierra Leone, Ivory Coast, Guinea, Senegal, Mali. Majority live in the Southwest Philadelphia area. The Sudanese and East African community, a lot are in the Northeast of Philadelphia. And then we have Delaware County, Darby, Upper Darby, Yeadon also has a large African community. We also serve Caribbeans, and so it's primarily Haitians that we work with, and approximately 30,000 Haitians, I believe, Haitians and other Caribbeans are in Philadelphia, and they primarily live in the Northeast as well. And I believe there are more women than men. Well, we serve more women than men. That's probably for many different reasons, but there seem to be more women than men, not too much, maybe 60-40%. And this community involves children, adults, and elders as well. And again, the needs of the community vary, right? We have African immigrants who come to the US primarily for higher education. Research has shown that most highly educated group of immigrants in the US are African immigrants. And it's clear, you know, so you have that community that are coming here for higher education and are pretty well settled and integrated. And then you have the community that we serve, who are here for different reasons, maybe civil unrest in their home countries, seeking economic empowerment. And so those are people who are on this, who are more vulnerable, I would say, and need more hand-holding in terms of getting integrated and becoming more self-sufficient.
Thank you for that. Do you know what's the approximate average age of the immigrants you serve? And also, relatedly, what is the main reason that the immigrants come to Philadelphia? Why do they leave their country?
In terms of age, that I would say maybe adults in between 30s to 50s. That is pretty wide, but I think that's what I would say would be the 35 to 50 age range might be the largest age group. And like I was saying, people come for many different reasons, higher education, or because of civil unrest. You know, we have a huge Sudanese community coming in now because of the war happening in Sudan. Unrest in Haiti is leading to the migration of Haitians to Philadelphia. So yeah, people are in search of economic, I guess, empowerment. You know, things in countries are not working well for them economically. So people are seeking their interest here. Yeah, so it ranges. Right now, we're seeing a lot of people coming from the border because of the same issues, looking for better economic pastures, I guess. Yeah.
Thank you. So then the next question, Dr. Koku, in your research and activism hats or roles, what is the experience of the Black immigrants in the Philadelphia area? So basically, what I want us to do is to paint for the listeners, and anybody who will consume this later, what the immigrants are experiencing when they come to Philadelphia.
Okay, thank you. Earlier on, Oni has hinted at some of this already. And I think in earlier discussions, I mentioned a word that she said she does not like, okay? And it's one of resilience, okay? One of resilience, right? In the face and in the context of all the acculturative barriers they face, that desire to be better, that desire to survive, that desire to be able to confront language barriers, other issues related to legal status that we know only describe the socio-demographic composition quite broadly, yes, but we have a huge number of undocumented immigrants around who have to survive here, navigate healthcare systems, navigate employment options, try to get there and then adjust their status as well. All right, so in the context of all this, one of the things that stands out really well is the issue of resilience, right? That desire to be better, that desire to be able to improve their lot, attain higher educational standards, as Oni has already alluded to. Yes, there are other issues, barriers they face in terms of healthcare access, language, and so on, lack of insurance, access to insurance, and then regular places of, preventive care, and so on. All those are known documented barriers here that we are aware about and that research has shown. All right. In addition to that, also, there are cultural issues that are part and parcel of their experience or they've experienced back in their countries of origin, and how these cultural values and expectations sometimes cannot be underplayed, because whether you've been an immigrant 1 year, 2 years, 20 years, or 30 years, you are part of a broader, a wider culture that continues to influence you regardless of how long you've been here. And therefore, as researchers, we tend to pay particular attention to these enduring influences. In the past, communication barriers were there, and that maybe in some way could have maybe limited some of these cultural influences. But now with advances in communication, it has even become much more prevalent. All right, so the cultural forces are there that both sometimes can play very positive roles, that we know can be very protective. The family networks are very strong. The values that are passed on from generation to generation are quite strong, and the expectations are high. But at the same time, we also have to admit that indeed there are some other cultural elements that can be, increased risk for some reason, but also sometimes need to be addressed. In other words, maybe to be able to increase people's health and welfare, and then also increase their use of services and engagement in services as well. So the experiences for me, yes, I know the barriers are there, but I'm always impressed about what I call resilience. But I also know that there are the downsides of resilience, that in one way, what it implies is that sometimes we tend to underestimate risk, we tend to underestimate coping abilities, and that has implications for broader type of things like mental health, which is a huge issue, which is very tied to what I call resilience, because in some ways, there is a tendency to overestimate people's capacities and underestimate the toll of mental health on them. Oni has been involved in the FGM project. I have also been involved in the FGM project. You sit in the discussions and you see the extent of the downsides of this resilience, and how sometimes culture can be accommodating, but then there are downsides to that accommodation. And we need to be able to step out of that objectively and look at our own culture and see the downsides of it.
Yeah, and I think, can I add something,
yeah,
Dr. James? Because of what Dr. Koku was saying, it's true that, you know, resiliency is a word I try not to use too much, because I think it puts so much pressure on us to be strong when we don't need to be strong sometimes, right? And that's based on culture, is based on how people were raised. We see the same issues now with our youth in our after-school program, where expectations from African parents are so high, right? You know, in the homes, if you come home with a B, it's like, what do you mean B? B is the minimum you should ever try to get in the African household, or you're going to be in trouble. But we have a lot of intergenerational issues now with parents and their children, where the schools are under-resourced, underfunded, the children are not performing well in the schools. There's a lot of tension in the homes between the younger children and adult parents who are trying to hold on to their culture, and children who are trying to integrate so they don't get bullied. And so what does that mean for the long-term health of our families? As you know, family is extremely important in African cultures, right? And so when you migrate, some of that starts to whittle away, the strong family structures that we have back home. And so what is the impact of that on every generation, whether it's youth, whether it's adults, whether it's elders? What does that mean as we look forward to, what does that mean for us as a community when this family structure is disintegrating? Because that's one of the strengths of our culture. And then when we think about the reasons people come, I don't know if this is the space for this, but when we talk about the push and pull factors that lead African immigrants out of our home countries, in my previous work, I focused a lot on that. What are the push factors that are pushing us out of our countries to have to migrate? And we have to be realistic and honest in terms of policies, right? There are many policies that the US implements in countries across the global South that is leading to people having to leave their countries. And so I think we sometimes put a Band-Aid on that, but it's also important to look at those things and how can advocacy within the US happen? Because we only see the people coming, right? These immigrants are coming, they're coming, they're coming. Why are they coming? And what is our role? What is the US's role in that movement of people from their home countries? Because nobody really wants to leave their home unless they have to. Yeah.
Yeah, thank you. And I think that's a good tagline, right? Nobody wants to leave their home unless they're forced to. So, and I think that's an excellent tagline right there. So there are two questions in the chat, and I want to make this as interactive as possible. We have pre-planned questions, but I like that the crowd is asking questions, that way they're involved. Question from Susan, and I'll direct this to Director Richards. Susan asks, when Black immigrants come to Philadelphia, is Philadelphia the primary destination, or do they move to Philadelphia from other places in the US? Director Richards.
It's a combination of both. Some people come directly to Philadelphia. I came directly to Philadelphia. Others will go to where they might have family or friends. People tend to go where there's a community and then move to Philadelphia. Maybe there's a bigger community here, or maybe they feel there are different opportunities. So I would say 50% come directly, 50% might come from other states. I know when refugees got resettled, they got resettled in some areas that might not have been very friendly towards immigrants, and because of that end up moving to Philadelphia. So I would say 50-50 in terms of direct or indirect.
Thank you so much. Dr. Koku, Dr. Eze asked in the chat, what is being done to connect the two streams of African immigrants you mentioned, those who are further in their education and are more settled, and those who came as refugees or undocumented immigrants?
Okay. Yes, there isn't formal processes as such, but then through many of the community organizations that we have. All right, so there are the formal ones that have been here for quite some time. So community events, Oni talked earlier on about, mobilizing funds and resources to support groups. So community events play a very good role in this. And every weekend within Philadelphia and many other big cities, you have events, right, that connect African immigrants, whether settled or not. So those are here. And I realized that sometimes the tag undocumented sometimes come with its own issues about the stigma and about the consequences of coming out and then the legal implications. So sometimes those are not really quite visible as such, but then the community-based organizations provide avenues for the two groups to get connected to each other and then to assist. I think this is where it really comes into being. All you need to do is to walk into AFAHO, for example, all right, to walk into their offices or to walk to Akana or any of them, and you see visible demonstrations of this about people who are settled and who are willing to commit resources and organize events to connect the two streams of those who handle. I was at an event, was it 2 Saturdays ago, and I saw a visible demonstration of this where undocumented was having some issues in South Jersey, and the community came together to help them. And it was organized mainly by the settled ones, those who have been here for 15 or 20 years, who have heard about this plight and were able to marshal resources, gather resources, housing, food, and other material resources to be able to help.
Thank you. I appreciate that. There's a term that all of you have used, the two of you have used, that I want us to investigate a little bit: undocumented African immigrants. Let's talk about them, because I think that in many cases, they're not even known, because many people always look at the Latinx undocumented immigrants. So, Director Richards, could you please speak to the plight or the experience of undocumented African immigrants in Philadelphia?
Yeah, so undocumented immigrants, of course, there's the stigma towards undocumented people, that they're here and they're taking up their resources and they're getting benefits, and it's all a myth, right? Because if you're undocumented, you have access to nothing, absolutely nothing, but you're working just as hard as everybody else. People with companies take advantage of undocumented people, where they will pay them way below minimum wage because they know that they will accept that. And so there are people who benefit from undocumented immigrants, but these people don't have access to any benefits. And that was extremely apparent during COVID, when there was so much assistance being provided to people, whether it's COVID relief or different benefits, and undocumented immigrants, despite the fact that they work 60 hours a week, and some of them do pay taxes too, they got no access to no benefits. There were many of the first responders that we saw during COVID, where people working in nursing homes or drivers delivering food to people with no protection, right? So there were first responders but had no protection and no benefits to assist them. And so when we've had a surge of people coming from the border, some of them are undocumented, they're in process of applying for asylum. But again, these are the people who are out, they're working, they're still working, they're still earning an income. Some of them pay taxes, and they're contributing to the economy, but yet don't have any of the benefits offered to everybody else. And they're also in the process of trying to acquire their documentation. But there's a huge, I think at AFAHO, we probably serve maybe 40%, 45% of our clients are undocumented, and it's very difficult to serve them because we're unable to access programs that are available to everybody else. They're unable to access those. But what we've seen too, again, is a community stepping up. When all of these migrants came from the border with no housing, we would have had a bigger homelessness issue in Philadelphia if the African community members who have been here longer did not step up and welcome these people into their homes. We've had families take people in so they wouldn't be on the streets. And that again shows the strength of this community. But yeah, there's a large undocumented group. And like you said, the language around undocumented immigrants is for the Latinx community. But that's because the African community gets hidden, and it's something we're trying to work on in terms of advocating. How can we be more visible when it comes to advocating for policies that could impact undocumented immigrants? And so that's an area that we're also working in now.
You just mentioned something that I have to follow up on. You said that the African immigrants are hidden. Why are they hidden, and why do you think that this is the case in Philadelphia?
Well, I think hidden because people are just, when you migrate for a purpose, you focus on that purpose. And most of the people who are undocumented are really just trying to earn a living and work and work and work. And so I think that keeps people hidden. And then also fear keeps people hidden. If you're undocumented, even riding a bike, we had a young man who was in here the other day saying that he's undocumented. And when he's riding his bike to work, he's always afraid that he doesn't drive because of the fact of fear. But when he's even riding his bike, he's always afraid that he will get stopped and arrested. There are so many people who are in jail now who've been arrested. And so there's a lot of fear that keeps people hidden, too. Yeah.
Thank you.
But there is
I
also,
think,
let me just add, there is also the experience of being hidden. But then there is also the official way by which African immigrants are hidden, right? And that is through what I call statistical invisibility, all right? And how does that happen? You look at the regular reporting statistics, surveillance reports, and all of them, you see that African immigrant groups are grouped together with, in the broad category of Black and African Americans, all right? This has a lot of other known consequences that we know that have been really well documented, and that you can't just homogenize all these groups, so that in the official sense, right, there is no distinction between who an African immigrant is and who a Black immigrant is from Caribbean, for example, or who an African American is. So when we are talking of being hidden, that is part of it. We don't have a broad sampling frame, for example, as a result of this, for us to be able to really have true estimates. So this has real consequences. And as part of our work with the Office of Minority Health, we try to call for disaggregating some of the surveillance data that on infectious and other health diseases. And some states do this, but it's not completely well done at the national level. So apart from the experience, there is that whole idea, there's that whole experience of being subsumed under a bigger category, regardless of the cultural differences. And therefore it becomes difficult to really characterize this on a really national level. And researchers have to do this on their own level and then be able to really characterize and describe the unique experiences of African immigrants. And this has a lot of disservice to the community.
Thank you, Dr. Koko. And you took that right out of my mouth, because I was about to kick the same question to you. So this is the beauty of working with smart people. So they read your mind. There's a question in the chat by Margaret. Margaret says that Margaret agrees that it's a myth that immigrants are taking the jobs away, but the reality is that many of the jobs immigrants are doing are undocumented, because on this topic of undocumented, most people do not want to do. So the question is, what are immigrant organizations like AFAHO doing around financial literacy? I think that was a mistype there, around financial literacy. So what does AFAHO do around financial literacy? And then Dr. Koko, you'll take after Director Richard, and tell us, what are researchers doing about financial literacy in the community? So Richard, and then Koko.
What was the first part of the question, Dr. James?
It's the same question. The question is about what are immigrant organizations doing around financial literacy for the undocumented folks.
Oh, I thought you said something about jobs, taking jobs or something. No?
That was a comment. It was just a comment
okay.
in the chat. Yeah.
So yes, we offer financial literacy classes both for our young people and our adults, because again, financial literacy is not something many of us are familiar with. Coming from home countries, some people don't even utilize banks. Money is dealt with in a completely different way than it is in the US. So whether it's understanding the credit system, whether it's understanding bank accounts, whether it's understanding how to not fill out every form that comes to your house for a credit card. There's a lot of financial literacy that happens. Our young people especially curious about that because, again, those conversations are not happening in the homes in terms of how you manage your finances in the US. And so many people have made a lot of mistakes due to that. And so we do have a financial literacy curriculum for our youth and one for adults as well. Everybody doesn't partake in it, but for those who feel the need to, that's offered. Yeah.
Excellent. Dr. Koku, what are some things that you as an academic or you know from the literature that has been done on financial literacy among undocumented immigrants?
Yes, not so specifically on not so specifically on undocumented immigrants, but as Oni has alluded to, these are not issues that are regularly covered. All right. And so a few researchers have begun doing stuff about financial literacy, understanding financial challenges among immigrants in Canada, in Connecticut, in other places where they are trying to understand how people make financial decisions. But it's a huge gap that exists in the literature. And there are some of the efforts are actually taking place at what we call the lower levels. All right. When students, for example, within community-based organizations, or sometimes through local organizations in small communities where people gather about or upon immigration, how do you navigate the credit system? How do you set up a bank account? And if you're an undocumented immigrant, how do you get a bank card? All right, those are issues, and there are ways that organizations can help people overcome some of these barriers. But in terms of academic research, not a lot has been done within the US here about financial literacy. And indeed, it's a big gap in the literature because most of the attention has been focused on health and other, social welfare issues.
And remittances. Dr. Bertrand will put that here.
Yes, and remittances is a big part about it. When I think we were talking about, when I think you asked questions about why people migrate, and we talked about the economic pool, all right? Mm-hmm. Remittances is a big part about it. Remittances is a big part about it, about helping their families and others, and constitutes a huge chunk of the GDP of sending countries.
Right. And how do you provide financial literacy from Western perspective when you get paid as an African immigrant, that paycheck maybe 40% is for you or 50%, and the other 50% is to support an extended family structure, right? And so again, the financial literacy curriculum that is developed here always has to be adapted to fit the context of the community that we're working with. Every other intervention that there is, it always has to be adapted to fit the context of our community. Yes.
Yeah, as a community-based group, we want to include the community. So Margaret Stevens, please unmute and ask your question correctly. I wanted to capture it, but I did not capture it correctly. Please, we want to encourage participation here. So Margaret, please.
Hi, I'm also an immigrant from Liberia. I came here as a child, so I've been here for a long time. And my question around financial literacy is kind of twofold. One is that most of the immigrants, whether they're African immigrants or Spanish-speaking immigrants, is that they're working multiple jobs. But how do we educate them to understand that you're working, multiple jobs, that paying into the system, whether it's Social Security or Medicare, that unless you pay into the system, and if you're working jobs where you're getting paid under the table, that you may be here for 20, 30, 40 years. And the myth that I'm going to retire and go back to Liberia or to Ghana, to wherever country, a lot of time that is a myth. But because most of the time we don't go back, we may go back and forth, but we don't go back to our home country to live, is that being able to understand that if you're not paying into those systems and you've been here for 30, 40 years, you then don't benefit from this system that you've worked and supported for many years. So that is part of my question around financial literacy, making sure that we are encouraging individuals that are working. And some of it are policy-related issues, because people are paid very low wages in a lot of those jobs. but also educating the community to be aware that we need to make sure that we are paying into the system, because otherwise you'll be here for 40 years or 30 years. You will never get the benefits that you've put into it. So that's kind of the gist of my question.
Thank you, Margaret. Dr. Oni, and then Koku.
It's hard. I completely understand what she's saying, but it's hard for undocumented. Of course, documented folks will pay into the system, you know, they're getting a paycheck and things like that. But if you're undocumented, and again, employers are taking advantage of undocumented people, it's hard to advocate for yourself because all you want is a job, right? And so if you're getting paid under the table, some people are just okay with that. And so it's difficult to move an undocumented person from getting paid under the table into getting paid the right way, where they have a paycheck, where they have deductions coming out of that paycheck, is difficult. And so, you know, some people are able to become documented, but for those who are undocumented, it's really difficult to be able to say to an employer, oh, I have to do this, because for the most part, they just want to be invisible and get paid and do their job. So it's really hard when you're in that situation. Yeah.
Thank you, Director. Dr. Koku?
Yes, and it's really very hard when you are in that situation. As Oni has said, for a while I belonged to a Ghanaian association that was trying to help tackle this issue in a very different way, to help undocumented think about some types of saving system. But again, the undocumented status makes this very difficult. So what we started doing at that time was to raise awareness, to think about not just remittances, but quality of life after retirement. I mean, only mentioned the age range, right? The majority are between 30, 40s, and 50s, right? In 20 years, retirement is going to be there. And for many, many African immigrants, particularly those who are undocumented or those who have not started work very early, we don't have the safety system, right? After 60 years. This is when the questions start, right? How much Social Security am I getting? And you look at the thing and you realize that, well, I'm going to get about $1,000, $2,000 a month. And the question comes, can I live on this money in the US here? So this is becoming a big challenge, right? Between the 50 to 60-year groups, where you realize that either because of immigration barriers, undocumented status, they have not prepared sufficiently for retirement, all right, which leads to other quality of life issues, inability to really take care of themselves at older ages. So we've been demographically been looking at the lower age group for quite some time, but I feel there is a bubble at the other end here. And I'm sure we've all heard about people who rush to go home and they stay for 1 year and they run back to America here. Why? Because they have not fully prepared. Or they live in America here, but then you realize that they can't really, really fully take care of themselves because they have not put or have been helped to put some of these safety nets in place for against retirement. So part of the conversation is shifting a little bit to help people to not only think of remittances, but to also think about preparing for themselves. Could it be a form of insurance that they can have? Even if you don't have the safety nets, you cannot contribute. Are there some other ways by which people can join a pool of maybe life insurance type of programs that could give them some benefits when needed? All right. So yes, it's a huge area there that they sometimes have not been fully captured.
And that's a bigger problem because when you think of, again, undocumented people who are working, contributing to the economy, putting money in for other people's retirement, but getting none of the benefits, right? And so the unfairness of that, and yet still they're being looked down upon, it just blows my mind. Yeah, because like in 20, 30 years, these people are going to have no safety net, but they've worked hard to contribute to the safety net of others, right? But yeah. And and when you're working certain jobs, even for the documented Africans, you don't have a retirement plan, right? Certain jobs, the low paying, low wage jobs, there is no retirement plan anyway, right? So you're working 60, 80 hours a week and you still, even as a documented person, you don't have access to these benefits when you need them. Yeah. And that's a system, that's a systems issue. That's not something you as an employee can advocate for because it's going to hurt, but that's a systems problem.
Yeah.
Yeah, and I thank you all. And I think that I'm glad that we explored that issue of undocumented immigrants who are from Africa and the Caribbean in the Philadelphia area, because as you can see, it's a huge topic area. And I really want to thank Susan Bell, who's actively putting nuggets in the chat. And her last point, or Susan's last point, is and working jobs like this put them at high risk for chronic health and diseases when they get older. And retirement and getting ready for retirement is in my wheelhouse, and getting older is in my wheelhouse because I'm a gerontologist. So I'm glad that we're talking my business here. And I want to applaud AFAHO for stating that they serve about 40% undocumented folks. And also saying that they've been facing challenges like being unable to access programs, and also applauding the community for being able to step up. And I'm really encouraged. And this is an answer to actually what Dr. Eze was asking earlier. What does the gap look like, and what can we do to bridge the gap? Well, the gap is that example that Oni just gave us, that the longer staying immigrants have shown a lot of help towards and support towards the new immigrants. And I can't thank AFAO enough. So segueing into the strength, from a point of strength. I know I don't want to call it resilience because Director Oni will beat me up. so, starting from a point of strength, what successes and intriguing stories make you look forward to working for or with the African immigrant communities? So we'll start with Director Oni, and then we'll go to Dr. Koko.
The one I mentioned about the community stepping up and hosting people to prevent a homeless crisis in Philadelphia was one that really moved me within the last couple of months when we've had this influx of migrants coming. I remember one morning we came to the office and there were probably almost 50 men outside the door, and we're like, where are you all coming from? And they had come up from the border and somebody had given them our address, right? So they're in here in the office and the day is going on, and I'm just, what do we they cannot sleep here, like, what are we going to do? We couldn't call the shelters, there are no shelters available. And just, I always say it felt like a miracle that day where the staff started to make phone calls. One of my staff members actually took 4 of those people home that day. And the community members started coming to the office and they were like, I can take 2 people to my house. This old man who lives in, for senior housing, he came in, he's not old, sorry, he's maybe in his 70s. And he came in and he took 5 of them with him. He was like, I can't, just for now, at least. And nobody was left here that day. So I was just truly amazed by the community stepping up, just with a phone call to them with this crisis. We have these men here. We don't have a place for them to sleep. And just the trust, you don't know these people from anywhere, but they were still willing to open up their homes. We have some who are still with these families. So the community focused, the family focused part of this culture is the most beautiful part of it, right? Where people look out for each other, people help each other. And I've seen this in so many different aspects. Like I said, my staff opening up their homes to people. And so that just makes me want to keep doing this work because the community and the staff give back as much as we give to the community gives back to us. And so, yeah. There's so many other stories, but yeah.
Thank you. When you remember one of them that's interesting, just stop us and you'll tell us the story. Dr. Koku, what are some, I know you had started and said culture is a big protective factor, but what are some strengths that you've witnessed through your academic and your advocacy work?
Yeah, one of the things I really like about the community is their own investment. All right. And when COVID hit, okay, how communities are going to respond to all the confusing messages was a big hurdle. Organizations like AFAHO, like Akana, took this job upon themselves. There were no pamphlets, right? Mm-hmm. And my head of department, Dr. Susan Bell, put a comment in there about issue about language invisibility. Everything was in English, all right? How do you communicate social distancing in a language that our people can understand? How do you communicate all the confusing and daily, rather contradictory information about COVID? to our community. So what did we do? We use our own local health navigators to go to the community, to encourage people to get tested, to encourage people to get vaccinated. So these were really community-based, community-informed, community design type of local strategies that really helped. And then in addition, most of the testing and vaccination sites were far away, very, very out of the way from the community, out of the trolley lines. And so what did the community members do? The structural support was really very limited. So through the CBOs, they organized transportation trips for people to go get tested, go get vaccinated on very, very shoestring budgets. All right, so the community's own investments, its own efforts is something that I really like very much about the community. They are interested in their own welfare. They have the resources in terms of the manpower and are willing to take in health messages and become the sort of trusted partners to the bigger organizations that they operate with, usually through the CBOs that we have here. So that investment, that desire about community members and community agents to seize the help, to seize the messaging, and be able to apply it to their community in a way that we understand is really very important here. And I must say something about the role of the community-based organizations, like AFAHO, all right? We talk about the community in general, but sometimes we miss the important role that the CBOs play, very, very often on shoestring budgets to help the community. All you need to do is to go to their offices to see firsthand how they operate. I have seen AFAHO, at least not from its very origins, right? But through its various iterations until it's now under the able leadership of Oni. And they've gone through a lot. But the issue is about, with very little budget, right? In rooms sometimes that don't even have air conditioning, but they have to keep providing services, all right? In rooms, in areas that have little structural support from the government, very little budget, but it is that commitment to keep helping the community. And their presence is really very important as a visible symbol of representation over here because the community sees them. They feel they trust them. When the vaccines were being introduced, right? Our people were not going to the clinics. They were coming to the local clinics in the CBOs. That is where they were coming to. That is where they felt very welcomed. And so they become really very much, and this type of community-based design services are really very important for health promotion and then other type of education programs. So yes, it is the investment in the communities that the community members themselves own and love. That is something that I find quite reassuring about working in the community.
Just one more thing about COVID that just came to mind, going back to my point about the family-oriented structure and the part of the culture. When people were trying to promote the vaccines, it was just like, keep yourself safe, keep yourself safe. And when we talked as a community, as a staff, about how we would change the messaging, the first thing we said was, it's not about you, right? If as a young adult, if you're healthy, you don't really, if you didn't want to take the vaccine, that's on you. But as soon as we changed the messaging to keep your grandmother safe, keep your neighbor safe, keep an elder in your community safe, it completely changed how people thought about the vaccine, right? So some people got the vaccine, not because of for themselves, but because of people around them to keep them safe. And so that just, again, goes back to, you know, when you're creating messaging for this community, it cannot be from an individual perspective. It must be from a family and community perspective, because that's that's our sort of guide star, right? It's not about me, it's about everybody else around me as well. And I think that's an important piece and one of the strengths of this community that makes our work easier.
Excellent, thank you. So you folks mentioned ingenuity, ownership, familism or community-based principles, and you also mentioned the important role of AFAHO, and I'm glad AFAHO is here. And you also said that they're on shoestring budgets. So if there's any department head, like I hear Dr. Susan is here, if you have any funds, there you go. Anyway, thank you folks so much. I want to make sure that we give an opportunity for people to ask questions because we want to include the crowd as much as possible. So if you have a question, again, remember to put it in the chat, or you can raise your hand and unmute, and then you can ask the question. Now, historically, there's a new thing happening in Philadelphia, and I'm glad, Director Oni, you mentioned it earlier, moments ago, about a group of people just dropped at your office. So busing. busing is happening, and it's a new concept, I believe, for the immigrants from Africa in Philadelphia. So, what are the new experiences or challenges that are coming with this new wave of immigrants? Director Oni and then Dr. Koku.
Yeah, it's, I've been doing this work for some time. I've never seen this migration from the border of Africans. And I'm just always amazed. How did you get there from the continent, right? Like, how? Because for the most part, Africans who are coming to the US, we're flying in, right? From the continent, we're flying in. And these people are going through South and Central America with harrowing experiences, so much abuse taking place. So, and it's just, yeah, the journey that they're taking to come here, is really unbelievable. We had one woman with 2 children, and I didn't even want to ask her, what did you go through? I don't think I could handle her story that day, but and so we have these people coming in, and so I also, again, going back to the push and pull factors, what is really going on a bigger scale that we're not privy to? What is happening in these countries that is moving these people out? How are they getting across? How are they getting to the border? How are they coming in? There's a bigger, I feel, something more sinister happening, because it's not making any sense to me. But they're here now, and the issues that are coming, is housing. How are these people going to live? Is work. We have so many men just around our office here, and they're day laborers, just helping different warehouses, they're at Home Depot, they're at the restaurants, because they're here for work. Most of them are here because they're looking for work. And so trying to find employment for them. A lot of them got A numbers at the border, and with an A number, you're able to apply for asylum within a certain time frame. So trying to get them legal assistance to apply for asylum, so that they can become documented. So English language, most of them are coming from 3 primary countries, and those countries are not English speaking countries. And so none of them speak English. So our ESL classes we have a waiting list of over 100 people. Yeah, some of them have health issues due to what they've experienced, some very difficult health issues that we've been finding out recently. So we have to get them access to healthcare. Yeah, so those are the main issues that we're seeing now. Yeah.
Thank you. Dr. Koku.
Yeah, and Oni and the rest are more on the front line, but through visits to some of the offices, yes, these are the huge issues. And for me, the migratory journey itself has potential implications for cumulative mental health outcomes over time. Okay, and they go through harrowing journeys. I asked one of them how long the journey takes, right? And these things have been in progress over years, all right? And the experiences have been very rough. A colleague of mine works, tracks some of these immigrants, some African immigrants who travel through the border. And this has been going on maybe for about 6 to 7 years now, but not in this large wave. So 5, 6 years ago, you see a couple of them who come in, trickle them through. But over time, some of the mental health issues begin to manifest themselves. And this is a huge barrier already in terms of the cultural understanding of mental health. So the consequences for them, the provision of resources, these are huge. In just like AFAHO, in the other sister organization, Akana, they have similar issues, challenges about accommodating them. ESL classes, getting them numbers that can allow them, getting them accommodation, and also, again, with very little resources of support from the city, okay, which is partly related to the invisibility issue that we have talked about. So part of this rests on the 2 main, actually, CBOs here who are working in the city, be able to show that is responsibility. And there is very little that they can do at this point. So they try to do that, and the potentials, consequences about this, how do we address them, right? How do we start to head them off, right? Oni, go ahead, yeah.
No, I'm sorry. I was just echoing what you're saying, is that the CBOs we are the safety net, right? We were the safety net during COVID. When COVID happened, the city didn't know how to reach this community with vaccines. When the community didn't know they were not getting benefits, some people lost their jobs. We never shut our office down, right? AFAHO was shut down from March of 2020 until August of 2020. We've been back full-time in the office since August 2020. We don't work from home. So just the toll that takes on the staff, right? We have families of our own that we have to care for, but we also are committed to this community because they are our family as well. So the fact that, and we did this with no funding from the city, whether it's the COVID issues, whether it's the border people coming and us trying to figure out how to utilize our resources to serve them. This is why I don't like resilience, because it's as if you all will figure it out, right? You don't need support to figure it out. You will figure it out. And I really think that that is unfair, because we are providing a service that the city, whether it's COVID, because when COVID impacts one community, impacts everybody. So you can't say, oh, those African immigrants, if they get COVID. No, if they get COVID, everybody else is going to be impacted by that. This border issue, everybody will be impacted by that. If we don't house these people, if we don't find them employment, if we don't keep them with mental health services, that's going to impact everybody in the city. So we can never look at anybody's issue and say, it's not my issue, it's not my problem. We are fulfilling what the city is supposed to be doing without support, because we're supposed to be resilient, which is unbelievable.
Put a pin on the city, because I want us to finish with that. Because that'll be the question about the gaps and the available policies for these immigrants. That will be the last point. But I want to echo your sentiments on this resilience thing. It's been a word and a phrase used for Black women in the United States. They're strong and they're resilient, and because of that, services are not provided to them. And I can see the line, the connection between what you're saying and Black women in the United States. But there's an excellent question. I don't know if I'm biased or not, but I think it's a good question by Dr. Muruthi, the other Muruthi in the chat. It says the Black immigrant men coming into Philadelphia seem very young, or they could be very young people. And the Dr. Muruthi is curious about how our FAO feels about the risk that these young men specifically have in the Philadelphia area and in the United States in general. So, Director Richard, please address that question about the risk that these young Black men have, or these Black African men have towards health and etc.
Yes, you're right. The men coming from the border are younger. They're probably between 18 to 35, the ones that we're seeing. And, you know, Philadelphia is going through challenges now. And what happens if organizations like FAO were not here to surround, like to cover them, right? To help to guide them, to help to direct them, to help to lead them. It's very easy, as I was saying earlier, you can't see this as this community's problem. This community's problem will become Philadelphia's problem, right? And so what happens if you have all these young men who are unemployed, unhoused, can't speak English, don't know what to do? What do you think, what is really going to be the outcome of that, right? And so as an African organization, it is our duty to provide services to these men, regardless of whether we have funding, because I shouldn't say that, but we will serve them, we will help them, we will guide them. Some of them are in our youth program, so we have mentors in that program. Like I said, helping them to find services and access to different resources. We will do the best we can do and continue to try to advocate for resources to be able to do more. But because this is not an FAO issue, this is not an African immigrant issue, this is a Philadelphia issue. And so it behooves everybody to want to be involved when there's one community that is at risk, because we all get impacted by that.
Thank you.
And
Dr. Cole.
I also had to add that this is already an existing problem. All right, in the area of HIV, for example, you have a second generation children here. It's a huge issue, right? They grow up within our communities, but then you realize that in some cases they are caught between that cultural space, which are partly African, but partly over here. And so this is a burgeoning problem already. And then you add this to it with a very huge population that is facing elevated risks over here with very little structural support. So some of the initiatives that FAO is doing is in place to find peer support for them is really very important here, because as you rightly stated, there is very little structural support. Yes, they have an A number, but how much can the A number do? All right, when you come here, So what happened is that organizations have to figure out ways of getting them what is called city IDs, for example, that can help them at least get access to some really very basic services over here within the city. So yes, attention needs to be paid to the, because it's an important group that demographers are here, Dr. Eze, are here. This is going to balloon in about 5-6 years' time. It's going to become a huge problem from this population.
And when you think about the madness of service providers, right? The other morning, somebody shows up at our office, a woman with a note from a large hospital that she was bleeding, right? She was hemorrhaging. And this hospital gave her a note with our address and said, they told her they had stabilized her when she went to the emergency room, but because she was undocumented, there was nothing else they could do for her. And they told her to come to a FAHO. How can $1 billion hospital institution send somebody who is hemorrhaging to an organization like a FAHO? What are we supposed to do, right? But again, that just goes back to my point about how we are seen as a safety net, despite the lack of resources. And what did the staff had to, she was here the entire day. And I don't know what miracle, again, that my staff were able to do to get her the services that she needed elsewhere. But that just shows an example of the lack of humanity, right? If somebody is bleeding, you don't say you stabilize them and then send them to an organization down the street that doesn't have resources or the capability to serve her. Yeah, it just, and that happens so often, where we're seen as for larger institutions.
Yeah, and sometimes they use the culture, right? Under the guise of, well, this is hot, this undocumented African immigrant, all right? So AFAHO is a big organization here, so let's stick it to them. So part of the way for AFAHO to utilize, leverage its existing connections with other providers, all right, who can then help. But you realize that indeed this has been happening quite some time, and some of those moves by the big hospitals are hidden under the guise that, well, this is a cultural issue, it's a medical issue, but let's put them to an organization that can help facilitate the patient's access to resources, which is really very unfortunate now because it kicks down, basically kicking the bucket, unfortunately.
Yeah, thank you so much for your responses. And a follow-up question, because you mentioned $1 billion hospital sending a patient who's hemorrhaging to the local organization. Dr. Eze asks, how is AFAO primarily funded? How do you get the $1 billion?
No, we are not the one.
No, they don't get it.
Dr. James, I need you to be very clear. I said the $1 billion institution sent a client to the $100,000. No, please do not get this twisted, Dr. James. This is not a $1 billion organization.
I wanted to shock you. I wanted to see whether you're really listening. You are listening. So, but Dr. Eze asked, how are you primarily funded?
Foundation funding mostly. Most of our funding comes from foundations. You know, I will tell you this transparently, we have 20 people working here and our budget is $1.5 million. So that should tell you that nobody here is like living large because of being paid here at AFAHO. People are doing this work because it's heart work. And again, most of that money comes from foundations. We have one grant that supports our FGC program. That's a federal grant. Two federal grants that support our FGC and our domestic violence housing program. But the rest are all federal grants.
Excellent. Thank you so much. And the last question.
Sorry, foundation.
Foundation.
Yes, yeah. Foundation. Thank you. The last question has to be on policy. You folks have hinted that there's gaps. Now, instead of giving you an opportunity to drag Philadelphia further, I want to put you on the spot. So you are sitting on the board of Philadelphia Immigrants Wellness Group. I don't know if it exists, but I'm creating it. So give me your top 3 priority policy areas that you think should be addressed from an academic and activist perspective and from a director of a community organization's perspective. We'll start with the director, Richard's place. So you have a blank slate. You need to create some policies that really will impact the health and wellness of African immigrants. What areas are you going to focus on?
Data. So I think we talked about it earlier. There's something I wish the city, for us to be more visible in the data, right? Disaggregate the data would help. When I sent a lot of my clients to the city health centers and I call them and say, tell me the health issues you're seeing my community has, so I can develop programming. And they say, I cannot give you that because the data is not disaggregated. Disaggregated data in the health space will help us understand the health issues that we face so that we can develop community programming for that. When we think about health equity, what does health, how do we reduce health disparities? That's through ensuring that we have culturally competent healthcare providers. So how can we develop more culturally competent healthcare providers? How can we encourage more African, Caribbean, immigrants to move into the health field, because your provider makes such an impact on your health outcomes. And so what is the pipeline to encourage that? We have children in underperforming, under-resourced schools. I am an advocate for more adequate school funding because we're getting children who are unable, not ready for university level education, who end up dropping out because they cannot cope, because they have not received the education that they need. So what can we do early to start to support them in schools, to get them into some of these fields where we need them in order to help improve these health outcomes that we're talking about? But more funding for the schools, better resources for the schools, this aggregating data, and then how can we improve the pipeline to get more culturally competent providers and more providers that are immigrants.
Excellent.
All right,
Thank
that
you.
was just a top, so I hope that was okay. Sorry.
No, there's no right or wrong. There's no right or wrong answers. In fact, you know this stuff more than everybody in the chat, I believe. Dr. Cook, what are some policy gaps that, if you are sitting on a board of Philadelphia's Wellness for Immigrants, you would propose?
Oh, she stole the first one from me. So it's going to take data, right? Because a couple of jurisdictions do this already. Yes, we need a national directive on this, but then in the absence of that, some other regions have started doing this, Washington, Minnesota. So yes, disaggregating data is one. Another one, which again stems from some of the experiences AFAHO and ONI have been having, where health providers basically push cases, basically, well, this AFAHO, let's send them to them. It's maybe some way of creating what we call an asset map. All right, what are some of the community resources available and that can help members of the community health-wise and social service-wise, particularly for new immigrants who are coming in, or even maybe for even existing ones. All right, there have been several attempts at doing this, but then these maps have to be available, right, to other broader providers that see African immigrants, so that a person goes to St. Christopher's, for example, right, very far away from AFAHO. And I think Oni and I have talked about this in the past, where people were basically referred from over them to AFAHO, right? Look at the distance, look at the zip code, all right? So maybe having existing resources around. There are medical providers around who can help, that have existing partnerships with the CBOs and in the community, and making sure that this information is known to other providers, because African immigrants do show up in some of the most odd places, right, all at them. And then providers who are not so much culturally informed either take misguided decisions, inform them, or misdiagnose them, or maybe take decisions that are really not very appropriate. So having some way of navigating them to appropriate services where they can get really well culturally informed care is one of them. But then also to leverage existing partnerships with universities and researchers around that we have. Across Drexel, Penn, and Temple, we have quite a robust community here, and being able to at least not make it so siloed by having resources and maybe many grants and other resources that can help connect both organizations. We've talked about the health navigators, which are really very important as a pipeline between the community and then to bigger health systems. That's a way of maybe trying to help them have access to culturally informed care. So those are some of the things, information about, you are talking about the invisibility a colleague and I are just putting a grant together on autism. All right, we are doing an existing one already with not based purely on African immigrants, but we are at the very early stages where we are collecting data about autism issues within we call it the low socioeconomically deprived populations. And so the issue of African immigrants come up quite often. We know that these conditions exist. All right. But where are the services? Where are the supports for populations who are going through this? It's quite an invisible population. All right. So structurally, the invisibility is very huge. All right. So if there are some ways of disaggregating the data so that providers and other policymakers are aware about the population, it will be very helpful.
Well, thank you very much, you two, and I want to thank you for your time. We have about 12 minutes slotted for this discussion. I would like to give this opportunity for people to ask a question. If someone has a burning question, before I give the two panelists an opportunity to say their last words, I would like to invite the crowd. If you have a question, please put in the chat or open your video and just ask the question. This is an opportunity for you. If there's none, we'll soldier on into the closing parts of this discussion. Anyone?
I have a question. It's Margaret. I have a question.
Okay, go ahead.
I wanted to find out, do you see a difference in the immigrant population? I'll use Liberia as an example, that came either before the Civil War in Liberia or after the Civil War. So for example, I came after the initial coup in 1980. Yeah, do you see a difference in the immigrant populations that come, say, as refugees compared to those that come either before there's unrest in a particular country or come afterwards?
I think the main difference would be those who come with documentation and those who come without, right? Because if you come to the US as a refugee, if the US brings you here from a refugee camp, you come with your documentation in order. If you come as a student, you come with a student visa. So I think it just is based on how people come, how long you've been here. I think the longer you've been here, probably the more adjusted, more integrated you are. Whereas newcomers, based on what they're going through, lack of support and resources, lack of documentation, face different barriers. So I think it's how people come, what status they come with, how long they've been here, or if they're new arrivals, that makes the difference. And economically, some, like when we look at all the medical schools and business schools, Wharton's Black student population is largely African. So they are coming here with a completely different experience. So I think it's based on your status, the reasons you're here, and the duration of your stay. Yeah.
Dr. Koku, do you have anything to add to that?
Yeah, and also now at least the services and the supports, I wouldn't say they are better, but at least they are much more established for the newer immigrants. At least there are places they can tend to, as opposed to the old ones where in the previous generations, they arrive here with very little type of places. At least regardless of the nature of the budget, there is a place called Afaho, right, that you can go to. All right, regardless of it, there is some level of support here. So maybe in terms of the acculturative barriers, right? Yes, it still exists, but at least there is a starting point, right, that you can get to. And some of these have been fairly mainstream in a way, despite the fact that there are little supports that are available.
Excellent. Well, thank you, folks. I hope I'm not closing anyone out, but I want to give the two panelists an opportunity to give their last words, maybe 3 to 5 minutes each. They can say what is in their heart. So our intention today was to understand the experience of new Black immigrants in Philadelphia. So the question to you as we close is, what is a takeaway for you? What is something you want us to take away from this discussion? What should we know about the experience of new Black immigrants in Philadelphia? I'll start with Director Richards and then Dr. Koku as we close.
So somebody had their hand up. Did you?
No, I did not see it. Did someone have their hand up?
I think Alex Isa.
Dr. Eze, please.
No, I was just clapping for the panelists.
Oh.
Thank you, Doc. All right, Director, please.
I think I've said it all today. African immigrants, African Caribbean immigrants have added so much to the city in terms of development, in terms of economics, in terms of bringing our culture. And yes, though we have some people who are still on the margins and need support, we also have many African immigrants that are contributing a lot to the city. Many of the doctors in the hospitals, the nurses, the professors, business people, creators, innovators, there's still many in that space who are doing well and contributing to this economy, this city, this country. Yes, but we also have those who need a little bit more hand-holding to get them to a point of self-sufficiency, but everybody's here for a reason. We all have the push and pull factors that have us here today. But I feel like with resources like a FAHO, with like Icona, other organizations, other support, that is possible for everyone to sort of have a level playing field and be able to I guess bring out the best that is in them to contribute to this city. Philadelphia is home, second home to many, and so we're all trying to do our best to work together to make this city what it should be, and having the right partners, equal partners. Sometimes partners come in and they think that they're above because they have the resources. And so having access to partners who see us as equals and come to the table as equals is also very important because we have just as much to offer as a billion-dollar entity. I always say that the solution to a problem is never coming from outside. The solution to the problem is always going to come from those who are facing the problem. And so utilizing communities to figure out how to solve their problems and how to develop programming that is much needed. Yes. So thank you for having me today. This was great. I'm happy to be a part of this. Thank you.
It's been a pleasure. Thank you so much. Dr. Koko, your closing remarks.
Thank you. And I also piggyback on what Oni said. For me, it's about health equity. All right, that there's a huge population with not, I wouldn't just say potential, because we all know the beauty and then the achievements of the population already. So there is further work that needs to be done. We have contributed a lot to the diversity, the language-wise of this, the US over here. The community-based organizations and the larger community are doing a lot of work. They have owned the problems and some of the challenges that the community faces. And daily, weekly, they are trying to figure out ways to solve and address some of these in the context of all the, the precarity that they face. One thing, of course, that we also need to be aware about all the time is what Oni talked about the push and pull factors, mainly how neoliberalism that is going on in our countries of origin, where we come from, sometimes has a large influence on the shaping and the contours of how our survival and the type of issues we face in the US here. So be attentive to the broader issues that actually affect equity and access to resources here. So the movement across the border did not just happen over time, of just in one day. It's been going on, brewing for some time. And the broader dynamics of what is going on within the US here versus outside, because that is what is pushing us to move. Formerly, it used to be just one way to move in, but right now we have other issues where people move in, then resettle, the back and forth. And that introduces different type of dynamics that we have never really very faced. People who are actually transitioning between the two of them. So yes, we have that, but I think with support from the community, we are able to maybe thrive under these conditions. So thank you all for this, and we hope to continue the conversation.
Thank you very much, and I do appreciate you. And from my desk, thank you very much as your moderator. Thank you very much, my panelists. You made the discussion that much easier to have. But last but not least, I'd like to give this back to Dr. Opeyemi, who was the brains and minds behind, one of the brains and minds behind this. This could not have happened without her, and it's just correct to give her an opportunity to shine as well. Dr. Opeyemi, please.
Thank you very much, Dr. Maruthi. And I want to just react one of the things that Oni has said. I had smiles, I've had goals, pimples, bumps all around me because the African spirit, the Black immigrant spirit is really a spirit of family. I didn't have any intentions to want to come shine or show. I just was so happy the story is being told. And I like how it ended because I felt like Dr. Eze is a big shot to ask the right question. How are you being funded? Let's throw money at this as much as possible. Thank you everyone for joining. I truly appreciate your participation, the questions that you asked. Thank you very much, Oni. This is so dear to my heart. I feel like posterity is the only thing that will reward you of all the hard work that you're doing. Dr. Coco, same goes to you. And all of us that do all the hard work we do for the immigrant community. Dr. Maruthi, this is an amazing session. We are going to be engaging you more and getting paid gigs for you to do this. As next steps, you'll be receiving emails from us. Dr. Maruthi is also behind, the nicer Dr. Maruthi, as we call her. She's somewhere behind. Let me see if a video is on. It's not yet on. She's in Viteseva Grants, right?
I'm here. Thank you. And thank you, Oni. Thank you, Dr. Koku. Just saying thank you.
Okay. All right. So expect to hear from us. We'll send out the recordings and you receive emails from us. Thank you very much for joining. Have a very good afternoon.
Thank you,
Thank you.
everybody. Thank you.
Bye.
Thank you, everyone.
Thank you,
Thank
everyone.
you.